This program is made possible by American Senior Benefits Wichita is all about your peace of mind. We specialize in asset protecting, safeguarding your health, planning your estate, and preserving your freedom of choice. We're here to work through all of this with you. American Senior Benefits Wichita proudly supports PBS Kansas. The Candle Club, a place where friends, food, and music come together. Currently, we offer live entertainment every night except Sundays. Enjoy our delicious specialty appetizers and the Candle Club Signature Prime Rib. More about upcoming events at candleclubwichita.com. Home Health and Hospice of Kansas is a locally owned and community-based provider. We offer quality health care to our patients and families, complete with love, warmth, and compassion. We'll take care of all of the details for you. For more information, please visit kansashomehealth.com. Welcome to Cedric Plaza Retirement Community. Our living options are designed to suit your specific needs and activities that you're sure to love. We believe you'll be able to see yourself here, enjoying time with friends and family. For more information, visit cedricplaza.org.
Welcome to Empowering Seniors. I'm your host, Katherine Ambrose, and today we're talking about aging in place and the types of services that you can have in your home to make that possible. We're going to talk about in-home care and skilled health care at home. I'm with Susan Kiefer with Kiefer Senior Care. Susan, welcome to the show.
Thank you.
Susan, tell us a little bit about your background.
I am a registered nurse, and I was in-home non-medical before I opened my own company. I've been doing this for about 8 years now.
Wow. What exactly do you do? It's in-home care, so tell us what in-home care is.
So we have, in this industry, we're called different names: companion care, in-home non-medical, as well as respite care. So what we do is we come in and take care of those in their home and keep the seniors safe in their home so that they can stay at home as long as possible.
So non-medical, so what are some of the services that you provide when you're in the home?
So we do cooking, cleaning, meal prep, medication reminders, bathing, errands. We do their laundry. We can do pretty much anything that they really need us to do. But the biggest thing is companion care, and we support them in their home and whatever they need.
Do you also communicate with some of the other maybe professional services that they have and maybe adult children?
Absolutely. So in-home non-medical is based on, it's usually private pay or long-term care insurance. And most of the companies in town that do in-home care accept private pay or long-term care insurance. So we work really well with hospice companies and skilled in-home care as well.
So medication reminders. So tell us a little bit about the parameters of that.
So medication reminders include, we set them up in pill boxes, and then we remind the senior to take their medication. It's one of the biggest things that most adult children see with their aging parents in home is that they're not taking their medication, or they're forgetting what time it is and whether they've had the dose or not.
Mm-hmm. So I would imagine that you are probably helping to support a lot of the things that would benefit quality of life.
Absolutely. So another thing that we do is we take the clients, we call them clients instead of patients, we take the clients to their doctor's appointments, because it's always great to have another set of ears listening in to what the doctor is saying. Often when you get news from a doctor, you're focusing on that and you miss the rest of the sentence. So we go and we help with that. And then we also call the family members as well and let them know what's going on.
I would imagine that a staff person going with them to the doctor can help make sure that all the questions get asked, because sometimes you forget what you want to ask the doctor when you're actually in there.
And that is so true. We all do that, not just seniors.
Mm-hmm. For this industry, can you share with us a little bit about how credible the caregivers are that actually come and work in the home?
In the state of Kansas, all applicants have to be submitted to the APS registry, and that's the Adult Protective Services Registry. Mm-hmm. All caregivers, CNAs, CMAs, home health aides, whichever staff you're using, they also have to be background checked. So the state of Kansas will review the background checks, and they are the ones that actually say yes or no whether you can hire that staff member. And then some companies go further and do independent background checks as well. So you have the state of Kansas monitoring through theirs, as well as the Adult Protective Services. So if there's ever a caregiver out there that has been accused of or is in the process of going through an issue with a complaint of abuse or neglect, that is always pulled up. And so you cannot hire that caregiver until you receive that piece of paper that is stamped with approval for hire.
So the companions that are hired, what are some of their training and backgrounds?
So industry-wide, we use caregivers, which are your non-certified staff members. So they are people that are not a certified nurse aide, certified med aide, a CMA, or a home health attendant, or an HHA. So there's different categories of the people that are going in, and it's based on the skill that they need in order to take care of the loved one in the home.
How does that work? So you maybe have someone that's a companion, and then on the opposite end of the spectrum for non-medical, what would that look like?
So it is very confusing because we are non-medical. However, most clients will require a certified nurse aide, certified med aide, or a home health aide. And that is only due to, it's just another level of education, it's another level of training, and they're able to do a little bit more with the client because you have gait mobility, you have training, you bring in, your skilled home health, they're gonna have physical therapists coming out, they're gonna be home exercises to be done. Nobody wants to do home exercises because they're boring. So these staff members are gonna come in and they're gonna work with them, do those home exercises. They're gonna talk to the physical therapist, the occupational therapist with tips and tricks of how to a more stable gait, better mobility issues, as well as look for safety issues in the home. Mm-hmm. So the higher you are with the level of care or the caregiver is providing, then you do want those certified nurse aides, you do want those home health aides because they're just a higher level of education.
Not only can home exercising be boring, but also just making it part of your routine can be a challenge, or remembering the exercises. And so I could see how a companion would be helpful. So for someone to successfully age in place as long as possible, maybe in a home that they own, a home that they're renting, or maybe an apartment, could be just a regular apartment complex, or could be independent living. Those would be all scenarios where having in-home non-medical care might come into play and help you have better quality of life. How do you know when it might be time to interview in-home care companies to see who might be a good fit for you?
I think the time has to come when whether you have adult children, other family members, spouses, when the caregiving, they are needed more and more to check on mom, to check on dad. When those times come, then you know it's time to get some extra help in the home. The forgetting of the medication, falls are a big one. Nothing moves someone out of their own home to an assisted living, to an independent living, than a fall. You break a hip, you break your shoulder, you're going to decrease mobility and all kinds of things. And that's usually why seniors have to leave their homes, is due to a fall. When those things are happening or you're seeing those issues, it's better to bring somebody in then.
I would imagine it might be good to just kind of do your due diligence and do some interviewing, maybe way ahead of time, just so you kind of have a feel on who you might call if the need really arose.
Oh, absolutely. You should always interview. I don't know why many people don't interview different companies. You really should. There's a lot of companies in town that do in-home, non-medical, and they're good. Every single one provides something slightly different. And the biggest thing is to make sure if you are paying someone to come into your home, you need to be comfortable with that someone.
Let's talk about rural areas and smaller towns. How easy is it to find in-home care like this in other areas?
It's really difficult. I get calls all over Kansas. If I know anybody, if there's another company out there, it's very difficult for that. A lot of companies, though, have extended. We're licensed for 100 miles inside from our office, and we're right there in College Hill. So we have 100 miles out. Now, just because I can go to Winfield doesn't mean I have actually the staff that's available to go to Winfield. And then you run into the logistical issues because if you're only having someone come to your home for a couple of hours, but are driving 30 to 40 minutes to get there, it's just logistically not sound. And financially, you need those longer shifts, but financially many can't afford it. And I wish there was a solution for it. There just isn't.
So I would imagine, though, that if you were to receive a call from someone in Newton or Winfield or Altoona, Kansas, maybe you would have a suggestion on where they might try next.
Yes, like I said, there are more than one company. There's a lot of companies in town that do this, and we all work together. Wichita may be a city, but we're really kind of a big little town. We know each other, we work with each other, and we absolutely reach out and talk, problem solve, and try our best to make sure that person is getting help.
Welcome to our show on PBS Kansas, and you've been a supporter of our local PBS for over 50 years.
Yes, ma'am.
And you walked in carrying a PBS Kansas mask.
I do use it. It's a very good mask.
Well, we picked the right person to be on the show. Tell me what it's like for you to have medical services come into your own home versus having to leave.
Especially right now during the coronavirus, it is such a blessing because we can get the care that we need without having to try to go out in the weather we've been having.
You have an apartment home at Cedric Plaza.
Correct.
And then you have home health services that are supplemental to that you bring in on your own.
Yes.
How did you make the decision to utilize home health services?
It was a no-brainer. It really wasn't, because this was something that I feel very comfortable with, in knowing that there is going to be someone that I can depend on if I have a problem.
How often do they come in to see you?
Oh, they usually average a drop-in about 2 or 3 times a week.
So are they just kind of checking up on you?
Oh, not necessarily checking up, but just making sure everything's okay, and if there's something going on, or something bothering me.
What would you say to someone that maybe is in their own home or apartment somewhere and they're hesitant to check into home health services?
It doesn't cost a thing to check into health services, and it's for their own benefit. And you never know when you're going to need some help somewhere, someplace along the line as you get older.
Do you think it's a good idea to maybe plan in advance and know who you would use in the future if you were going to need help like that?
You'd be very smart to do that, because you don't know when you're going to need it.
I would imagine there's probably some comfort in just knowing, okay, these are the people that are going to take care of me.
Absolutely, absolutely.
And it makes things easier, it sounds like, in just dealing with your doctor and dealing with everything.
Yes, because they are a lifeline for anything that we need. And if you have a service that you're going to need and you can't get out to it because something has happened, they bring it to you.
Meet Jerry Baker. He's a resident at Cedric County Plaza, and he utilizes home health services. Jerry, thank you for being on the show.
You're welcome.
So tell us about what that experience has been like for you.
Really, it's been a lifesaver with this COVID going around, because I don't have to go to my doctor. I don't want to go to my doctor. And with them here, they can come to my apartment and do the same things, and then they'll relay the information to my doctor.
How often do you have home health come in?
At first, they were coming in about 3 times a week, because they was evaluating me, and I was also kind of evaluating them, you might say. But my condition at the time, I needed it, and it wasn't just home health, it was also the physical therapy part of it that I was having.
Do you have them less now?
Yes, about once a week now.
Okay. So Jerry, you mentioned that you were also evaluating them.
Right.
Tell us about that.
Well, at first you're kind of leery. You kind of feel them out, and are you comfortable with them, and so forth like that, which I was really liked it.
What type of personalities have you experienced as far as the people that come visit you?
I like them. I haven't found the one yet that I didn't like. I am a people person, and my first observation is usually my best. And so far, I haven't found any that was not helpful in that respect.
Have you ever felt like they were rushed or in a hurry?
No, absolutely not. They took the time to hear my problems, and not only that, but we kind of even got on a repertoire of just our own beings, you might say, of what we had in previous lives, or things like that, and more like a home.
Yeah, it sounds like friendship.
Yeah, exactly what it was.
Yeah, so you make friends with them. I'm with Brian Spear with Kansas Home Health and Hospice. Brian, welcome to the show.
Thank you.
One thing I thought you could do is help explain the difference between in-home medical care and some of the kind of graduating services.
Sure. So in-home medical care does things like skilled nursing, things like occupational therapy, speech therapy, physical therapy. It's all under the order and direction of the primary care physician or a hospitalist if they are the ones that ordered it. Sometimes people are coming out of a rehab facility and they're needing to just continue that rehab, and so a home health company will go in and continue on whatever therapy or skilled nursing. Maybe there's a teachable skill that we need to do in the home that maybe family members aren't quite aware of, maybe setting up meds for the first time, that sort of thing, especially coming back from a hospital stay.
You have non-medical in-home care that's kind of companion care.
Correct.
And then you have home health,
Yep.
which helps oversee maybe or coordinate all the medical services.
Correct, yeah, and they'll pair up with non-medical care companies just to be able to provide that overall care coordination. We really want to make sure that everybody out there has both the skilled need as well as the personal need that a home attendant may actually provide. And there's several levels of in-home care with a skilled service as well.
Tell us a little bit more about skilled services that people can have in their own home.
Sure. So traditional home health would be just those types of skilled services like I was talking about. Skilled nursing services, maybe some wound care, speech therapy, occupational therapy, physical therapy, those types of services. Another level of care that several companies offer is what they call palliative care. Think of it this way, a skilled home health stay or visit would be something where it's short term, right? So we're trying to help correct an injury or an illness, get somebody back from maybe they had a knee replacement or maybe they came down with pneumonia, and we're just trying to get them back to being as independent as we can. The palliative program is more designed for people with long-term clinical diagnoses, things like congestive heart failure, things that may not get better over a short period of time, but they're going to need longer-term monitoring and education. That's what those are.
Is palliative care something new, or can you tell us a little bit about the history of palliative care?
Sure. So palliative care is a little bit newer, if you will, and there's companies run it different ways. Some companies run it on their hospice, so think of it more of a hospice light. It's for people that aren't quite ready for hospice yet. However, they still want to seek a little bit of treatment, that sort of thing. Other companies, such as ours, actually run it on their home health side. So it's more of home health on what I would call home health on steroids. For the insurance piece of it, we don't have to hit certain gains all the time. You still have to be medically appropriate for the services, but where the short-term home health, traditional home health, says, hey, if you're not making any gains on your therapy, if you're not walking any further, then the insurance company may say we're going to stop paying for that service. Palliative has a little bit more leeway with those services.
Okay, well, that's a new distinction for me. So home health might be a little more temporary, and palliative is to take care of chronic things,
yes,
longer
very
term.
Much chronic.
Okay. How can that benefit seniors living in their home to make life a little easier, and also for their loved ones?
Sure. So the easiest way to think of this is having a care coordination team. When you bring in a good home health company, they're going to have services that are available to you, again, based on what the doctor orders, but they'll also have other services that are kind of outliers, things like social work and other things that can come in, other people that can come in, home health aides, that sort of thing. And they really want to help coordinate and provide the overall service package for the family. The idea here is keeping people in their home where they're safe, where they're comfortable, where they're making their medical choices, not being run by somebody outside of the family or somebody that doesn't know their own wishes.
So you have autonomy. You're in control of your destiny, and you're just bringing in people to help.
Absolutely, absolutely. And I would tell you that I'm sure a lot of people understand this, but patient choice is a huge aspect of this. don't be afraid to interview several companies or talk to them ahead of time. In fact, try to reach out to companies well before you ever need services. And then we can start building a relationship with them. They can understand who you are and what you're doing and see if they can take care of your needs, because you don't want to find out at the last minute this is the company you're going with, and then all of a sudden there's something that's lacking in the way you want them to care for you.
And can have huge disappointment and stress.
Absolutely.
So kind of pre-book or pre-plan what company you would use in advance.
I would highly recommend it.
Because I would imagine you can come out and do free consults and free interviews.
Many of the companies will. Some companies run a program that's based around that. Yeah, most companies will at least come out and answer questions for you, that sort of thing, at a time and place that's convenient. Obviously, we want to social distance right now with COVID going on and all that, but we can do video chats or on the phone consults as well.
Okay, or go to their home if they're comfortable with that.
Absolutely.
That sounds like it could be something on your Empowering Seniors to-do list, is interview home health companies and find out a little bit more about who you would choose to call if you need help.
Yeah, absolutely. And be very open with them. These are the disease processes I struggle with. These are the things that I'm going through. These are the types of services that I could foresee me using. Or maybe even ask them, what types of services would you offer to somebody that's going through this particular disease process?
So Brian, explain the difference of palliative versus hospice. We know we don't want people to be confused, but tell us the difference.
Hospice is really the most amount of services that Medicare will ever allow to go into a home. It's a very robust, strong medicine that goes out. A lot of people think hospice means I'm giving up, and really it's not about giving up. It's more about what choices you want for your life. How do you want to live? It's not about dying. A lot of people think hospice is a last-ditch effort and there's no other resources out there. But quite often we find that by giving the body a little bit of relaxation, coming in with strong medication, giving your body a chance to breathe, if you will, then your disease process tends to take a backward step. So you feel a little bit more comfortable. You are able to still do the things you want to do with your family, that sort of thing. We've all heard of the cases where somebody goes on hospice and less than 2 months later they're gone, and it was very drastic and everything else. And that's unfortunate because a lot of times people wait too long to start consulting for hospice. Hospice really is a way of bringing a lot of resources to bear for not just the patient, but also for the family. I would actually tell you that most of the services for a hospice patient aren't given to the patient at all. A lot of them are given to the family. It's the grief counseling, it's the social work to make sure that they have all their affairs in order, make sure they've selected a correct funeral home, all these types of things. And families really need help navigating those because they don't know what to ask mom and dad or how to even approach the subject. It's such a taboo thing sometimes to talk about. So having somebody who's very skilled and educated in that field really does help just bring that conversation along.
Well, a big benefit of hospice is that all the family can be there, can come and go if you're in your own home.
Absolutely.
And that today is such a relief.
Yeah, the ability to have the care coming directly to you, whether it be a chaplain service, whether it be a home health aide or a bath aide, or whether it be your nurse or whoever might need to be there for your skilled care, and still allow your family at bedside. We heard too many times, unfortunately, during COVID and all that, the hospitals were locked down, and if your loved one was in there and they were on their last couple of breaths, unfortunately, they just weren't letting people in. And that was scary for a lot of people. I couldn't even imagine, being on my last time on earth and not being able to have my wife or my kids right there with me. A very sad situation, but I think it can be prevented with proper planning.
So I have a friend who's graduated off of hospice a few times, where during her time with cancer, they called in hospice and that was going on, and then she got better. And I think that happened 2 or 3 times at least. And now she's doing really well, and she doesn't even have home health right now.
Yeah, it does happen more often than what people think. Now, I'm not here to give any false hopes by any means, but again, hospice is very strong medicine. It's not something where you're giving up. You're sometimes giving your body the best chance of fighting. You can seek traditional treatment for things when you're on hospice. Let's say you had a fall and you banged your hip up or something like that. You can still seek that medical treatment while you're on hospice. A lot of people think you've given up all your doctors and all your hospital visits, and that's not the case. But for your primary diagnosis that you're on hospice for, That's what the hospice company is there to treat. The hospice company is really there to help make sure that you're a little bit more relaxed, that we can help reduce any pain, that we can give you the serenity sometimes as your body needs to heal itself. And more often than not, you have that relief, you have that release. And I'll be frank with you, a lot of times having the family around, that spiritual aspect of it, that's what makes modern day hospice so amazing. So hospice is able to really help bring the best of all the worlds, both medical help, spiritual help, social help, and that just gives us the chance and opportunity for our body to really fight.
Brian, you may have struck a chord with a viewer out there. So tell them what a starting point might be so they can get connected to the right people.
Sure. I think there's several starting points that everybody can reach out to. Your Empowered Senior Series, both at Botanica once a month, and then the TV series is an amazing resource. Some of the other places to look into, definitely check with your doctor's office. See who they've used before. Mm-hmm. You can check with the Department of Aging. If you have somebody going through memory issues, you can always reach out to the Alzheimer's Association. We all are a community of caring people. And I'll tell you, I can only speak to the Wichita and greater Cedric County area, some of the surrounding counties that we abut. But we're a big family. As many companies are out there, we're all there for the same reason. We're all there to care for people, help them out. And so I would reach out to any of them and just start asking questions.
And no matter what county someone is in, there's always a Department of Aging, so you can contact your county. So that's a good starting point. Or reach out to someone that might not even be in your own city, and oftentimes we can help people get connected.
Yeah, we have connections all across the state. And so anytime that somebody calls in from an out of area, we may not be able to serve that area, but we can certainly point to or set them up with a company, an agency, or a person in their area.
Thank you so much, Brian. That was so helpful. And thank you for watching. If you have questions about any of these topics, please reach out to empoweringseniors@kpts.org. Until next time, I'm Katherine Ambrose.
This program is made possible by American Senior Benefits Wichita is all about your peace of mind. We specialize in asset protecting, safeguarding your health, planning your estate, and preserving your freedom of choice. We're here to work through all of this with you. American Senior Benefits Wichita proudly supports PBS Kansas. The Candle Club, a place where friends, food, and music come together. Currently, we offer live entertainment every night except Sundays. Enjoy our delicious specialty appetizers and the Candle Club Signature Prime Rib. More about upcoming events at candleclubwichita.com. Home Health and Hospice of Kansas is a locally owned and community-based provider. We offer quality health care to our patients and families, complete with love, warmth, and compassion. We'll take care of all of the details for you. For more information, please visit kansashomehealth.com. Welcome to Cedric Plaza Retirement Community. Our living options are designed to suit your specific needs and activities that you're sure to love. We believe you'll be able to see yourself here, enjoying time with friends and family. For more information, visit cedricplaza.org.